Now we're going to start talking about some of the different injuries that can occur at the knee. Our first group of injuries is going to be dealing with the ligaments. Like I said in our last video, ligament injuries are one of the more common types of injuries in our knee. So the dreaded ACL, anterior cruciate ligament. Reminder, the ACL keeps my lower leg, my tibia, from moving anteriorly. Okay, ACL injuries are going to be more serious than some of our other ligament injuries, and most oftentimes will require surgery. Okay, reminder, we see MOI. MOI means mechanism of injury, or how the injury occurred. And you get this from several different ways, but when the athlete is attempting to change directions, running, stop, pivot, turn. Okay, twisting that lower body, especially if you're twisting your lower body and your foot is staying planted. You can also get this with excessive hyperextension, so having somebody fall on your knee, okay, that kind of thing, pushing it past its normal range of motion. Some signs and symptoms, it's going to be very painful. A lot of times the athlete can feel the pop, and it's, and every case is different, but usually you get lots of swelling pretty quickly. Okay, but on the other side of that, you can have some athletes that continue playing that just have minimal swelling, nothing too crazy. It is very different for every athlete. Okay, best thing for this, we are going to put them in a knee immobilizer, which is just a type of brace, because when this ligament is torn, it does cause the knee to be very unstable. So you'd put them in a knee immobilizer and crutches, and they'd follow up with an orthopedist. The more ice that you can get on them, the better, because it will help decrease that swelling. Hi, here's a picture of that torn ACL ligament right there. The top picture has one that's still in good shape. So this ACL is going to be one of our more serious ligaments that is torn. Our recovery time is about 6 months. That's kind of best case scenario. Even with the best rehab in the world and doing everything right, it still takes about 6 months, if not closer to 9, especially women. They tend to take a little bit longer to heal. Okay, so just kind of keep that in mind. Our next one is the posterior cruciate ligament. As a reminder, that posterior cruciate, that PCL, keeps that tibia from moving posteriorly on the femur. So it is just the opposite of that ACL. Our mechanism of injury here is falling on a bent knee, okay? The best kind of example that we see this is in like volleyball or basketball when they're running and they hit the ground. It's also called the dashboard injury, and the reason it's called that is because if you're sitting in your car and you are in a car accident and your momentum sends your body into the dashboard actually ends up hitting just below the knee, which causes that ligament to tear as well. It's definitely a little bit more common than the ACL, but can still require some surgery. Signs and symptoms, there's going to be a pop or a snap sensation most of the time. And it is going to have to be referral to the doctor, because they will do an MRI to make sure that it's just the PCL torn and nothing else. So this picture right here shows from the posterior view. And here is that PCL ligament in between the meniscus that is torn. This part right here is dealing with our ACL, but that's still intact. This is either surgery, or sometimes they just put you in a brace for a few months and it will naturally heal on its own. That we have is the MCL. Remember that any ligament is dealing with a sprain, so an MCL sprain. This is going to be the most frequently injured ligament in the knee, but that's kind of a good thing because it is one that tends to heal the best. Mechanism of injury is going to be receiving a hit from the outside of the knee that causes the inside of the knee to buckle, basically. Happens a lot. Football, soccer, people get hit from the outside of the knee. Right where your tibia and your femur meet is what we consider the joint line, and usually that's where we're going to have some pain. There could be a little bit of swelling. They might have what we call ligament laxity, meaning if we go to test that ligament, and which is basically like a rubber band, instead of it being nice and tight, it is loose, so it can move a little bit more than we would like it to. Doing the Price method is going to help with this significantly. Elastic wrap for compression. So if that's whether that's a type of sleeve or an ace wrap or anything, will help with this as well, especially the more severe this is. Thinking grade 3 instead of grade 1. We do have a little video from the Livestrong Institute that I'm going to show you that just talks a little bit more about the MCL. So let me move on over here and let's watch. Maybe.
Carolyn Cooper, and I'm going to be talking about MCL injury. The MCL, or the medial collateral ligament, is a thick fibrous tissue that spans the distance between the bottom of the thigh bone and the top of the tibia on the inside of the knee joint. When the MCL is stretched too far, it can tear or even rupture in severe cases. Injury to the medial collateral ligament can occur when a force is applied to the outside of the knee joint, such as a tackle in soccer, catching the inside edge of a ski, or even a very large, boisterous dog falling against the side of your knee. These symptoms of medial collateral ligament injury vary depending on the severity of the injury, and are usually local pain and swelling on the inside of the knee. There may be difficulty walking or pivoting or twisting, and there may even be pain at night. Treatment of MCL injuries initially consists of relieving pain and reducing inflammation. Therefore, rest, ice, non-steroidal anti-inflammatory medications such as Advil or Motrin. Some people may need to wear a brace to give stability to the knee, and with complete ruptures, which are very rare, crutches may be needed for the first few days. Once pain and swelling are improved, physical therapy can be instituted as the part of rehabilitation. Surgery is rarely required.
Okay, so that was a quick little video just talking about the injury. Not the most exciting video, but she did have a lot of good information. So our last ligament injury, is the only ligament we haven't talked about yet, is the LCL, which is the opposite of the MCL. All right. However, this doesn't happen as often because you usually have to be hit from the inside of the knee. Well, it's a whole lot harder to get hit from the inside of the knee, unless you're running and you're going to kick a ball and somebody hits the inner part of your leg. It just doesn't happen as often. But the same signs and symptoms, same treatment. We're just dealing with the opposite side, where that LCL connects my femur to my fibula. And so you can see here, with all of these ligament injuries, it's important to remember we still have our 3 grades like we saw in the ankle. Grade 1, just a few fibers are torn. Grade 2, a few more, and grade 3 is completely in half, which is what this picture is showing right here. Okay, anytime you're dealing with a ligament, it can always happen like that. 1, 2, and 3. It's not all or nothing type of thing. Okay, the next video that we will talk about a little bit more of the muscle and tendon injuries, and then we will be finished. Thanks, guys.